Did you know that people living with type 1 and type 2 diabetes are at increased risk of developing depression and anxiety than those who do not have diabetes? And did you know that people with type 1 diabetes are at higher risk for developing eating disorders? And women with type 1 diabetes actually are higher risk for developing bulimia, which is also an eating disorder. Well, guys, welcome to the Voice of Diabetes. My name is Diana Bitucci, and today I am going to talk about mental health and diabetes because we know that mental health is such a crucial aspect in helping us manage diabetes and manage our chronic conditions. And of course, depression and anxiety can make that much more difficult. But make sure you guys are watching to the end because I'm going to talk about the correlation of diabetes with mental health and things that you can do to treat depression and anxiety. Of course, we know that getting a diagnosis of diabetes can be very tough on people. Having to change your lifestyle, having to deal with medications, having different responsibilities, such as having to test your blood sugars, missing work, going to more frequent doctor appointments. All of those can become so overwhelming when we are dealing with something on a regular basis. You're not just checking your blood sugars once every 3 months, you're having to check multiple times a day. Maybe every day you're having to deal with new medications, learning about new medications, and learning how to change your way of life, live a completely different lifestyle that can become so overwhelming. And it can cause people to feel very anxious all the time. It can cause us to feel very depressed. We're feeling very low energy. You feel more isolated from the world. You feel like people don't understand you. And those are very common, unfortunately, because we know that diabetes is a chronic condition that we live with every single day. So it makes it hard when you have to deal with something every single day. But the point of this video is to really help seek out if you are having those problems, or if you know someone who may be having those problems, and things that you can do and things that you can try to help you. And the good news is many patients are able to have diabetes, depression, and anxiety and be treated for both of those at the same time. And it does not make it any less successful whether you have one or the other together or separately. The treatment is just as successful. So that's all very good news, guys. And fortunately, I've seen a lot of success stories and patients are doing very great, even with those who have struggled with some of these mental health issues. We know that managing your diabetes is crucial. Maintaining very good glycemic control is very important because we know that that is linked to less possible complications and reducing your complications of diabetes, such as heart disease, stroke, amputations, blindness, and much more. But mental health is just as important, and we have to be very mindful that we have to treat the mind, body, and soul all together. Otherwise, it can make us less successful in treating the other one. So if you are someone that is going through depression or anxiety, it can make managing diabetes much harder because of the lack of energy or the emotions where you may feel like, I don't even care about this anymore because you're feeling down. So it's very crucial that you can recognize those problems and you can ask for help because there's so much help out there that fortunately does work. And, it has worked for so many people in the past. In addition to depression and anxiety, there is something called diabetes distress. And that is where the patient really just cannot think clearly. They're feeling more anxious. It's very similar to depression and anxiety together, but this is more the worry of just diabetes, worrying that the blood sugars may go too low, worrying that the blood sugars may go too high, always focusing and always worrying about the diabetes. And we call that diabetes distress. Diabetes distress may not be able to be treated the same way, but there is treatments and there's a lot of supportive groups that can help with this. And I've actually encouraged my patients to join them, and luckily they've done very well. So don't forget that, if you don't have depression or anxiety, you may have diabetes distress. The symptoms kind of overlap with one another, but making sure that you recognize that and getting the help that you need is crucial. The number one thing about treating mental health is one, identifying the problem. So you have to identify that you're struggling with something. If you've been diagnosed and all of a sudden you are having, a difficulty concentrating, you can't really think clear, you're feeling very irritable all the time, or you're just feeling like I don't care anymore. Those are all possibilities and symptoms that you could be struggling with a mental health illness like depression or anxiety. So even if you are not sure, I highly encourage you to notice that there may be a difference in your behavior, and seeking out to get help for that change is very important. Otherwise, if you can identify it, it's hard for you to get the help that you need. Statistically speaking, 1 out of 3 patients struggling with mental health and diabetes actually go on to get the treatment that they need, and a lot of them state that they just didn't identify that they had a problem. So if you are someone that's watching this video and you can kind of relate, it's okay to talk to your provider, whether it's primary care or endocrinology. Bringing this up is very crucial because you'd be surprised how many resources are out there, and I want you to make sure that you're using all the proper resources. So that's, asking for help or telling someone how you feel is very important. And if you are watching this video and you feel like you may know someone who may be going through this, please share this video with them, and just kind of open up the doorway where they can ask for help. And of course, these treatment options that I'm going to discuss next have been shown to be very effective, and fortunately my patients have used several of these resources and have been doing very good. So I'm very proud of that. I know the mental health is so undertreated, unfortunately, but why not start treating more and more people and really getting people to their optimal health, not just clinically, but also mentally as well. So the good thing, as I mentioned, is that these illnesses are treatable, and a lot of times treatment modalities that I'm going to talk about are very helpful, and they've been able to help patients. So that's always very rewarding. This is why I created this video, because not a lot of people talk about mental health and diabetes, and I feel like it's so crucial that we address this, because we know that the two kind of go hand in hand. Because having to live with diabetes every day can become so emotionally draining. So sometimes you just need a little bit of help, and you need to use your resources that are out there, and to really get you at your optimal health, where you can maintain good mental health, but also it helps us better manage your diabetes as well. When you're able to, do the things that you want to do, eat better, understand your medications, take your medications, those are always helpful in managing diabetes. Therapy is a very effective way for managing depression and anxiety, because not only does it identify the problem that you may be having or what the problem may be, but it also helps you find solutions. So therapy is always a good option, and sometimes that's all people need is therapy, and they feel so much better. They're able to move on and feel great, and be emotionally very stable and feel very well again. Family therapy is also very helpful, especially for eating disorders. So, type 1 diabetics who've lived with diabetes and managing insulin for everything that they're eating are at higher risk with bulimia and certain eating disorders. So family therapy is always good, because you want to make sure that you're having a good support system, and that the family knows what's going on, because they're obviously they're involved in your daily activities. So that's a good option as well, especially for type 1 and eating disorders. Medication treatments are always also an option. Certain SSRIs can be very great for treating depression and anxiety. I'm not here as a mental health expert by any means. I'm in the endocrine specialty. I don't manage mental health per se, but I actually do always ask patients about how they're feeling, if they're feeling any symptoms of depression or anxiety, because number one, I always want to make sure that I can point out who may be struggling with a mental health issue, and I always take the extra step to always make the appropriate referrals. And sometimes I will start patients on an SSRI. I always try to stay up to date with treatments for depression and anxiety, because I know how crucial it is for managing diabetes. So of course, one and the other, they go hand in hand together, meaning that it's hard for me to manage diabetes if I cannot get the patient to be mentally fulfilled and mentally feeling their optimal best. So for me, it's crucial that I manage the patient as a whole, and therefore I will always start the patient on different therapies if I feel like I can. And in the meantime, I'm always making the referrals to experts who can help even more. But until they are able to get the appointment, I at least make the effort that I can to start them on some treatment options. Although your doctor may not be able to treat depression or anxiety, they could definitely help provide the resources that you may need, such as a referral to a psych, counseling, whatever it may be, or starting you on an SSRI. Primary care is usually very good at managing depression and anxiety. You can always talk to your family doctor first and seeing what they have to say and saying, hey, I'm not feeling my optimal best. I've been very down lately. Managing this is just taking a toll on me. Or even if you're not a diabetic and you're just not feeling your optimal best, you should always ask for help. Don't ever be afraid to, because you'd be surprised how much help there is out there. And of course, why not utilize the resources that are offered to you? So we all deserve to feel great and feel happy. So I want to make sure that you and all my patients are taking full advantage of the resources out there. Therefore, this is why I created this video, so that you can be aware that mental health is nothing to shy away from. You should embrace it and you should ask for help when needed. Stress management is also very important. So trying to keep a log of what's causing stressors in your life and trying to eliminate those are very crucial. And of course, making sure to see if diabetes is contributing to your emotions. So if you're feeling very down on certain times and you realize that your number was very high, your blood sugar level was very high, trying to correlate what's causing the problem is good, because we can really pinpoint what the problem is and we can try to manage and control what the issues are. So guys, I really hope you enjoyed this video, and I hope it at least made you more aware that it's okay to ask for help. It's okay to struggle with a mental health illness, and it's more common with diabetics. So this is why you especially want to be mindful and ask for help when needed. So don't be afraid. There's nothing wrong with feeling the way you are, as long as you're being sure that you are asking for help. And if you guys know someone that this video may help, please share it with them. And I will see you guys all next time. Take care.